Hi, I'm Chris LeBlanc, Czech practitioner and holistic lifestyle coach. Welcome to another workout tip at Chi Training Studio. This one today is for the ladies. And if you've noticed that you have chronic pain in your neck, your low back, and your feet, the problem could be what you're wearing on your feet. And the footwear I'm talking about is those lovely shoes with heels. When we have high heels on, our foot gets elevated and all the joints above it have to compensate. And if we didn't have the joints and we were nice and stiff or rigid like a piece of wood, what would happen with a 2-inch heel is we'd have a 22.5-inch forward lean. And with a 4-inch curve or heel, we'd have a 45-degree slope. Okay? So unfortunately our body isn't rigid, or maybe fortunately, and we have lots of joints. But what happens is your knees, your lumbopelvic, so that lumbar spine, your low back and your hips, your thoracic curve, and even your neck and head, they all have to compensate. They get thrown out of their optimal alignment or their position in space. And this results in a lot of stress on the body and more importantly results in some pain. So what we're going to have is our lovely model Tanya come over here and demonstrate what happens when she puts on heels. We're going to see her normal posture and then how quickly it disappears when heels are present. And to do this, we're going to use a little makeshift plumb line. And hopefully we get the angle correct for you guys there. Perfect. So what we're going to see over here is Tanya's knee joint, her greater trochanter, her acromion process, and her ear are all nice and lined up with this little makeshift plumb line, which is fantastic. What we're going to see is that nice little change happens. I'll give you this one. When we put on 3.5-inch heels. We're good. So once it stops moving, what you're going to see here is the knee joint is well in front. I'm going to keep it as straight as I can. The greater trochanter way in front. The acromion process, a slight shift forward. And we have a very little, but it is there, a little present forward head posture. So very common patterns, what's going on here. Either the forward lean or sometimes we have hyperextension. Tanya's showing that forward displacement. Sometimes it's coupled, which we don't have here, but it's coupled with an exaggerated lordosis or a lumbar curve. Again, she has a slight forward movement. Sometimes it's coupled with a exaggerated thoracic spine, and again that forward head posture coming over here. So this is again just going from barefoot to high heels. Boom, we have a little change going on in the spine. I'll take your hand here. We'll get you off those evil things. So that's within 15 seconds. What happens when we're walking day after day, week after week, month after month? We have thousands of steps. Okay, you can just imagine how much stress that body gets put under. And unfortunately, the poor feet, they get all compressed. Bunions are a very common result of this compression. Low back pain, that lumbar spine starts to lose its space. Again, we get that pain all through the side because all that ground reaction force daily starts to accumulate. All that force then runs up the spine and it's not resting spot correctly, so we get a lot of headaches going through that area. And virtually it's all thrown off from not being in that optimal position. So if you're suffering from these chronic aches, pains, headaches, etc., a specific stretching program coupled with a postural corrective exercise is absolutely the first step or the proper solution for you. The first step actually, and I do mean the first step, is downgrading the height of your heel and bringing it closer to the earth or getting grounded. So give that a shot. Try reducing your heel size today and your body will absolutely thank you. That's all for now with Chi.